Good evening, everyone, from the Rochester Academy of Medicine on East Avenue, and welcome to the Black Physicians Network of Greater Rochester's virtual gala, Black Doctors for Black Lives.
When we put together our 5-year equity and anti-racism action plan, the Black Physicians Network reached out to us as partners.
We are here because the insidious roots of racism over 400 years has gotten us to the point where our health is not as good as other people's health.
Sometimes baffled that you have to learn to empathize with someone in that way.
I'm one of a handful, we could probably count it on one hand, of people who provide primary care who are African American in the Rochester area. So we're really in a minority.
To that end, we demand that all institutions in Greater Rochester area invest in our Black youth, our young men and young women. Stand with us, my brothers and sisters. We need you to make this happen. Stand with us.
Hello, everyone, and welcome to Outrageous 2020, a whole new affair.
We did a little homework and realized how big the Breast Cancer Coalition is in Rochester, New York, and how much it helps people.
I'd been out there in the public quite a bit since I started my business, and I really felt that maybe if people knew I had breast cancer and had detected it early, that might help other women to go and get a mammogram.
Breast cancer touches all our lives, and it's such a privilege to have a group like BCCR.
When you donate money, you have no idea if that's going to be used in your community. But the Breast Cancer Coalition, I knew it was staying here, and that was so important.
When God brings you through 4 cancer battles, and you are still here, and you are healthy, and you're able to work, and you're able to have a family, what a gift.
A sense of humor is so important through this as well. And the community spirit and energy, which I miss these days with the pandemic, it's in this room.
It's the entire journey. They can shepherd you through the entire journey.
It's not just that they're there to support our research, they're really interested in our research, and it kind of works both ways. And so those sort of interactions have been really great.
I think about living a lot.
I have stage 4 cancer. I'm not dead yet.
This is something you're going to live with the rest of your life, but the key is living with it.
Good evening. Welcome to the Gateway to Healing Virtual Gala. I'm Paul Schwartzman, the Executive Director of the Finger Lakes Regional Burn Association.
When caring for a pediatric burn patient, we realize that we're not caring for that patient, we're caring for the entire family, because you have to provide support for the parents and siblings as well.
On January 24th, 2013, every mother's worst nightmare happened. One bad electrical wire made my house go up in minutes.
It doesn't just hurt your skin, it leaves a mark.
I love how I could share my stories and spend time with people that went through similar things that I did.
Camp Courage is an annual 4-day camp that is in the Finger Lakes region, and most of the time our burn survivor campers will transition into counselors in training, and then as they transition they go into adults.
I love the forming of the steel. I love to get metal that you can't form cold. I was working with some polyurethane that was too close to my stove and it blew up. I met Paul Schwartzman, and he gently guided me into a direction of recovery, but also a more stimulating capacity for me as I became a mentor to other burn survivors, and to be able to give back to people through the Burn Association. It's changed my life, all for the better.
Good evening, and welcome to the Hugs Foundation Gala, a celebration of smiles.
There's no words to explain what it means to me to see my kid happy.
We're very, very fortunate to be able to do this, to be able to come here and love what you do, and at the same time give back and get back a whole bunch. We're just so lucky.
Because of hugs, this father cries tears of joy as he holds his son in the recovery room.
We can't imagine not being able to have access to care if our kids needed it or if my patients needed it. So to see the smiles that these volunteers create for these kids is pretty incredible.
A typical mission takes about 6 to 8 months to plan. Mobilizing 35 team members, getting here, dealing with all the logistics, but this is my favorite part.
There's 50, 75 kids with clefts that are waiting for us to do surgery for them in that year.
Most of the parents, because we see them, because I live here, the first time they see us, they don't have any hope. Like, there's no hope. Moms get depressed. Most of them, they think their children will die.
I dedicated my career to doing not only surgery for these kids, but doing surgery for them at the right time. And it's a big concern for me of what the impact is going to be long-term for these kids who have a significant delay to getting the care that they need.
And then there is the complex choreography of surgery day in a foreign country, in a hospital where you're not used to operating. 5 days in a row, 5 operating rooms all going at the same time, 79 patients in all, 79 lives changed forever.
A lot of these families travel from days away, and it's amazing to think about that. You know, we all travel to get here, but by the time we're here, there are upwards of 100 families ready and brought their children, and they've made the journey here.
Being born with a deformity that's apparent to the whole world because it's on your face is something that's probably really difficult to live with as a kid, especially in a place where they don't have the resources and the availability to get this treated.
These kids show up here and walk into a room of 80 other kids that have the same problem. And then they get surgery and they get put on wards where there's 12 people in a room and their family members who are all having the same operation. They realize, I'm not alone.
You know, in terms of a cause or an organization, that there's anything better than changing a child's life forever. Because when we change children, we change the future, because it's going to come back to us.